coming to you in high definition. This is the Fox 9 Morning News.
Heart disease is the #1 killer of women.
To raise awareness, the Go Red campaign was launched. Coming up on the Fox 9 Morning News, we'll talk about some advances in healthcare and how you can get involved. It's coming up on the Fox 9 Morning News. But right now, we're talking about a disease that is largely preventable, heart disease. However, still remains the #1 killer of women. So this month of February is dedicated, of course, to Go Red for Women. Joining us this morning to talk about heart disease is Dr. Sharonne Hayes. She serves on the board of the National Coalition for Women with Heart Disease, and she's a physician at the Mayo Clinic. Thanks for joining us this morning.
Thank you very much. I'm glad to be here.
All right. So as I was talking to the doctor in the break, that, you know, there were so many things that we hear about heart disease, and we begin to maybe not hear it anymore. So you said there are a couple of key points that you want to make here today. And one of them is, it might be surprising to you, that it's really important that women become part of research, and it maybe isn't as big of a thing as you think it might be.
Well, I think that everybody thinks of women's health when they think about breast cancer research or hormone research, and they don't think about heart disease, but heart disease is the #1 killer of women. So if you had to say that is the women's health issue. So if women think about, if their doctor asks them, might you want your blood for a cholesterol trial or be involved in a high blood pressure trial, or can we use your information to help other women, or maybe even have a procedure, you know, research is going to help women, because that's one of our biggest gaps. Women make up only about 25% of participants in research trials for heart disease. So we're not going to be able to help ourselves, our kids, our grandmothers, our mothers, if we don't help doctors like me learn more about how to care for patients.
Even though you're learning more, there still is a lot of the unknown out there, and it's really critical. You mentioned generations, that we set an example for our kids and how we live our lifestyle and living a healthy lifestyle, because really we're passing along those genes and really how we handle life to our children and to our family members.
Exactly. And, you know, it's one thing to set the example, but through the research, we're finding that it's not just what we do in modeling behavior. Actually, the health of the mother is very important in terms of the health of her children. So if a woman is diabetic when she's pregnant, her child is more likely to be obese. If she smokes, her preschooler is more likely to have high blood pressure. So there are things that women have control over, and I think making behavior change, changing our lifestyle, quitting smoking, exercising, it's hard. And sometimes for women, they're not going to do it for themselves, they're only going to do it for someone else. So there are a lot of people in our lives that we can motivate women to do that for.
Let's talk about the event coming up. It is a National Wear Red Day. The date, by the way, mark it on your calendar, February 4th, a date to wear red. And what?
And I just wear it all February because it's just, you never know.
Yeah. Tell us what's going to happen for the event.
So it's a nationally designated day on Friday. Everybody wear something red. That can be a red dress, it can be a red tie. You know, real men wear red dresses on their pins or whatever. So it's an important day to show support for women with heart disease and to show that we can help prevent heart disease. But it's on the 5th, the following day, that AHA is having its big Mall of America event. And you can go there and see fashion shows, you can get health screenings, walk
Free
around.
Health screenings?
Yes, yes. Know what your blood pressure and your cholesterol are. So I think that both wearing red, and wear red both days, you know, all February. Yeah, why not?
All right, well, thank you. Some really good information to think about and obviously support women. And we want to get rid of, you know, heart disease completely. So this is a big part of that, one piece, shall we say. All right, well, thank you so much. Dr. Hayes is the keynote speaker at the Twin Cities Go Red for Women function. And thank you so much for being here to talk about this important issue.
Yes, healthy heart.